High patient acuity, unmanageable workloads, and lack of appreciation from patients and management are all reasons why I thought I was so burnt out from bedside nursing. But I was wrong. It has taken me 7 years to finally figure out the real reason why I have been so burnt out from bedside nursing. I love working as a nurse. I always loved praying with patients, singing with patients, pushing them out the doors for discharge, welcoming them in on admission with a big smile on my face. But why was I becoming so burnt out and so calloused? A little bit about my nursing backstory is that I became a nurse in 2016 and worked on a medical floor for about 3.5 years. From there, I then went on to work in the emergency room, which was my favorite job by far, but then I needed to move for my husband's job. So during that time when I worked in the emergency room, C hit. So along with almost every other nurse, C was pretty exhausting and really burnt us out. So then when I moved down here to Georgia, I started in an infusion center and left bedside nursing. But then after the infusion center, I went back to bedside nursing and started travel nursing. And now I'm completely not working at all at the bedside as I just had a baby 3 months ago. So I am currently staying at home, but that's not the real reason I left bedside nursing. I want to go back and talk about why I left ER nursing to pursue outpatient nursing and why I was so burnt out and what I finally realized after, 5 years ago? 4 years ago, 3 years ago of when I left ER nursing. And I came to this realization all from one book that I'm reading right now and all from about 1 to 2 paragraphs in this book. It has finally set in with me why I was so burnt out from bedside nursing. So what was so magical in this book that made me come to this realization? I'm going to read a paragraph for you from this book and also kind of paraphrase a little bit. But let me know and comment down below if you can relate to me in this paragraph, and maybe it will help you understand why you're burnt out. So I am reading from page 14 of Homeopathic Medicine at Home. And here's what it says about just meaning of symptoms. This book goes much further into detail, comparing standard medicine versus homeopathic medicine, but just listen to this and tell me if you agree with this. So on page 14, it says a comparison of homeopathy and standard medicine, or also called allopathy or allopathy. So meaning of symptoms, I'm just going to read just this little portion, 2 small paragraphs, and this helped me realize why I was so burnt out from bedside nursing. So meaning of symptoms, here we go. The homeopath believes that the body is always striving to keep itself healthy or in balance, just as a keeled boat attempts to right itself in the water. The force that acts in this protective manner is called the vital force. When the body is threatened by harmful external forces, the vital force or defense mechanism produces symptoms such as pain, fever, mucus, cough. These symptoms, although unpleasant for the patient, have a purpose: to restore harmony or balance. Pain is a warning that something is wrong. Fever inactivates many viruses that attack the body. Mucus is produced in the respiratory tract to surround and carry off irritating material. A cough expels the mucus that would otherwise hinder breathing. A homeopathic physician regards symptoms as a healthy reaction to the body's defense mechanism to harmful forces. Such symptoms need to be supported rather than interfered with. Standard medicine takes a different view. It regards symptoms as manifestations of the disease to be opposed or suppressed. Aspirin or other anti-fever drugs are given to lower fever. Antihistamines to dry up nasal secretions. Cough syrup to suppress a cough. And it keeps just going and going and talking about all the differences of homeopathic medicine versus standard medicine. And this was gold for me. This finally made me realize why I was so burnt out from bedside nursing. I don't agree with standard medicine. It has only taken me 7 years to finally realize this, from going from nursing school to now, but I agree with some things in standard medicine, yes, and I see the benefit of standard medicine, yes. but I do not agree with it as a whole. Let me just read one more sentence for you under the body, not the germs. Our aim, talking about homeopathic physicians, our aim is to strengthen the body so it can resist these harmful organisms, talking about bad germs. In standard medicine, on the other hand, the goal is to identify the invader and select a powerful drug to destroy the specific germ. We don't do this in standard medicine. Yes, we educate on a healthy lifestyle, but we're not really doing that. It's mostly come into the hospital and then let's give you all these drugs. You go home on all these drugs. We're not really going to talk to you about lifestyle modification or healthy eating. We spend more time giving you medicine rather than educating you on how not to come back to the hospital. It's like a cycle. We're almost creating patients to come back to the hospital. I can't believe it has taken me 7 years to finally figure out why I was so burnt out. Now, I never was able to put a word to it or quite understand why I was so burnt out, but I got it. I was tired of giving patients 15 medications at breakfast, lunch, and dinner, and then doing PRN medications in between, but in hoping that they don't react with each other and hoping they don't come back the next week because they didn't make any lifestyle changes. But I know that COPD patient probably will come back, or that patient who is withdrawing probably will come back. And I hate to sound negative, but I did bedside long enough to realize most people do come back and you do recognize patients and they just keep coming back. Not everybody, but a lot of people do. And I did not agree with what we were even doing in the hospital. There was things that definitely could have been addressed with other alternative ways to treatment or non-invasive ways to treatment. When you go to work every day and you don't agree with the treatment plan for a patient, that's going to burn you out, and that's exactly what happened to me. So what about you? Do you agree with standard medicine? Do you agree with homeopathic medicine? I didn't know what homeopathic medicine was until I started reading this book. I thought it was all this kind of hippy dippy kind of medicine. It's not. It's totally not. We actually used to have homeopathic hospitals here in the United States, which I don't think we even have one anymore. But this book goes into a rich history of why we don't have homeopathic hospitals or why they were phased out here in the United States. So what do you think? Do you love standard medicine and what you are doing in the hospital? Are you way on the other side and say, nope, I don't like standard medicine at all? Are you kind of in the middle like I am and see the benefit for it, but don't really want to practice it yourself and see the need to make a change in the hospital? I don't know. You tell me where you're at and comment that down below. I would love to get a conversation going with you. If you're a burnout nurse, comment that down below too. Let me know what you think is burning you out. It only took me, 5, 3, 2 years, whatever it was, 7 years to figure this out. I thought I was burnt out way long ago when I left ER nursing, and I thought I knew why I was burnt out. No, I didn't. It only took me until now, after reading this book, to figure out why I was so burnt out from bedside nursing. But other than that, that is it for today's video, everyone. Thank you for tuning in, and I'll see you in the next video. See ya.